Every once in a while, we're lucky enough to sit down with someone whose passion doesn't just light up a room, it ignites ideas, sparks change, and stays with you long after the conversation ends. Today's guest is one of those rare individuals, driven, insightful, unapologetically committed to making a difference, whether through his work, through his words, or the way he shows up in the world. He reminds us that what truly means to lead with purpose. Get ready to be inspired, challenged, and re-energized, because today we're diving deep with someone who doesn't just talk the talk, but walks the walk. Please welcome Mikhail Ilyabayev. Okay, today and on the Inner Edge, I'm speaking with Dr. Mikhail, better known as the Bike Rebbe, a doctor of physical therapy, head of and supervisor at ODA's DPT department, a passionate advocate for using cycling as a tool for healing and the human potential. You know, from the clinic to the streets of Brooklyn, he's redefining what therapy looks like. So let's start at the beginning. What led you to become a physical therapist, or led you to physical therapy? And how did your journey evolve into a persona of the Bike Rebbe?
Thank you, Ephraim. It's a pleasure to be here and express to the world my thoughts, my views, my journey, and how I ended up teaching people how to ride bikes, which I believe is a fascinating skill that encompasses a lot of different sub-skills. But I'm going to start with my own journey as to how I became a physical therapist. I liked playing sports. I felt very connected to the body and intrigued on how it works. And I felt that the highest position I can take in helping people is to get them back to, their healthy self, whether after an injury, after weight loss, or just to become a better person physically. So I started off being a personal trainer in my teens, and then went to college for exercise science, graduated with a bachelor's degree in exercise science, but I wanted more. Then I went to a DPT program, and I found my calling. Graduated, started working for different agencies with kids, with adults, different backgrounds, different needs. And then found a bigger calling to work with children and decided to do more skill-based therapy, which led me to work on bike riding skills. It all started in a school for children with Down syndrome in Brooklyn. And I applaud and I commend all the administrators and the principals and teachers who, were enthusiastic with the idea. When I came up to them and I said, "Hey, what do you think if I teach these kids how to ride bikes?" They said, "Yeah, give it a go." And I think that was one measurable goal that would show parents and the clients themselves if they were able to accomplish something. And that's how we got into bike riding. I bought some tools, some accessories to put on the back of the bikes, and we ended up, giving them a few lessons. We tweaked how we taught them and stuff like that, and Baruch Hashem, it worked out.
Beautiful. Wow. That's great. That's amazing. The school really led you to go forward. And here we are. You're not just a doctor of physical therapy, you're the head doctor of physical therapist, supervisor, I guess the physical therapy supervisor at ODA. What does that leadership role look like for you day to day?
It's a great question. It's a multifaceted answer. It's not easy to answer in one breath, but I can tell you the approach that I have as being a supervisor is more of encouragement, more of trying to get every therapist to reach their potential for themselves, to be their own boss, to motivate themselves, to have their client's best interest in hand. And ultimately, it comes down to, when you encourage and when you support someone and show them that doing the best for their client is really doing the best for themselves, treating other people like you would want to be treated. So I think that's one of the best motivators I can give any therapist. Day to day is just going through the client list, the patient list with all the therapists, and just figuring out a plan on how to treat and do the best they can for each patient. That's it. That's what it entails.
Wow. And you're based off of Brooklyn, I suppose, in a very urban environment. When it comes to, I guess there's a few questions. A lot of the listeners today, and we're in April of 2025. The next year or two, somebody wants to go into the physical therapy realm, explore the profession, and say, "Hey, I was really inspired. I love what PTs do. I want to become a physical therapist." Can you break down for parents, for God willing, future professionals out there, the real difference between, you have these three professions. You have a speech therapist, you have a physical therapist, you have an occupational therapist, and you work with all of them. And if people are clueless and they want to really go into the field, how do you define the real difference between all of these professions? A lot of, times people think, parents think, oh, PT is OT or OT is PT. It's the same thing. Or they think that a lot of PT PTs can do OT work and OTs can do PT work. In your line of experience, working with the patients, working with the children, working with different settings, especially in the ODA, how do you kind of, I guess, unpack the differences simply?
A good question, also deep. I will start by saying that anyone can do anything, and it all starts by doing your homework, researching what each one entails, whether OT, PT, speech. Most people think, or they have an idea based on them doing the therapy themselves as a client or a patient, or taking their children for those services. So they get that kind of image in their head on what that entails. But I would always say, do your own homework and spend a week or two at a facility as a volunteer and seeing if this, so to speak, job speaks to you, if this is something you see yourself doing long term and something you feel like will bring out the best in you, as opposed to a way of making money or being successful in a career. Because at the end of the day, if you're not going to wake up for a quote unquote job and say, hey, I want to do the best I can. Hey, I want to get up today and do it again. Because if you love your job, you're never going to work a day in your life. And if you're going to chase the money, it's never going to bring you happiness, true happiness. You're not going to get client satisfaction, because sometimes you'll wake up and you'll go to your job and you'll do the same thing you did yesterday and you're not going to find any success. But you know what? With therapy, it takes time and you have to be in it for the long haul. Sometimes you'll see a little progress, sometimes you'll see no progress, sometimes you see regression, but there's a big picture involved and you have to know your own personality, see what kind of person you are. If you want to see quick results, then maybe therapy is not the right job for you. But I would just say do your homework and see if it's something that you want to do and try it out. Most businessmen said, try it before you buy it. This is something that you need to do. And I would spend a week volunteering or two in a hospital, in a nursing home, in an outpatient facility, and just see different parts of that career that you want to jump into. That's my
Wow.
advice.
I love it. It's funny. That's exactly how I got into the field of occupational therapy. I I wasn't sure if I wanted to do physical therapy or occupational therapy myself, so I was advised the same thing at a young age, 17. I volunteered in a hospital, and then I went for a nursing home to see all the professions. I do have to say that's how I chose the field of occupational therapy, and I definitely respect all professions, but especially OTPT. These professions are timeless and they're so broad, and there's just it's really incredible. And that brings me to my next question. A lot of us right now, we're hitting just scratching the surface of the age of AI. And lots of people, millions of people, are nervous that they're going to lose their jobs, they'll be replaced by machines. Do you find that in our fields, the physical therapy, occupational therapy world, we have to worry as much and we have to really recreate our professions? Or do you feel that we are more secure in our profession and in our parnasa? Because a lot of people are nervous and they're afraid.
Okay, I see the question, also very deep. I would say that AI is not foolproof. There are errors. I can't tell you instances, but there are, and it's been proven. But it all depends on your belief and your faith. If you believe that everything that's created in this world can improve quality of life, can improve patient outcome, I don't think you'll be replaced as a therapist. I think you can use it to your advantage to see how it can improve, all patient outcome and your own quality of life. So I don't think it's a threat. I think it's something that we can use to help us with whatever we need. Again, we are more physical based. We have a license to touch, so I don't believe that the therapy world will be taken over with AI. I think it'll be helped, and if you can see it as a helper and not a threat, I think you can use it to your advantage.
Wow, it's amazing. Thank you for that. Going back to cycling, as I was mentioning earlier, you're based in Brooklyn, very urban area environment. How do you safely introduce cycling as a part of therapy in that environment?
We always train each client in an open area, like a park or a public schoolyard, with as little people as possible, and make sure that they are able to ride with the least amount of obstacles in their way. And once they're able to master the area, like in a park, without many obstacles, then we start to move them to a place that has a lot more people, or introduce people into the park, or come to the park where there's some more people who are playing or using the area, and create a natural environment that they're going to be riding in eventually.
Wow. Can you share a case or a patient story that really stuck with you? Um, Anything specific that you feel that can inspire someone else, or that can give somebody chizuk in different areas of treatment, physical therapy, or being a bike rebbe, or perhaps in any other endeavors, or in the role of supervisor?
Sure, I just want to start by saying how I got the name Bike Rebbe. There was a parent whose kid um, sent me an envelope with their son as payment, and on the envelope they wrote Bike Rebbe. So that's where I got the name from,
Well,
and I went with it. The reason I chose bike riding as a skill that you can find a lot more success in was because of working in that school with kids with Down syndrome, and then I felt like it was a skill that I used to get from place to place. It was a skill that I used to socialize with my friends, and it was something that I felt a lot of kids, especially in the Jewish communities, who may not have access to it or live in apartments and they don't go outside to ride their bikes as often. Um, I felt like it was something that kids can use in nice weather or in open areas, maybe in the summertime, maybe when they go to the country. So I got a lot of parents reaching out to me and asking me if I can teach their kids. So I said, yeah, and that's how we started. We moved from, say, one session, two sessions, to sometimes just giving them ideas, and how to start on their own with their own parents as being teachers. Um, It's also one skill that involves many different sub-skills, which is balance, coordination, strength, endurance, motor planning. I mean, you name it. If a child can do this, sometimes, it can take them to the next level. I remember I had one parent who reached out to me and asked me if I can teach their kid because their son was not, making friends and had a lot of anxiety. Um, so once we taught them how to ride, the child, had a lot more friends. This is what the parent told me if, a few weeks later, that the child had much less anxiety and was making much, much more friends, was not being bullied. So I said, hey, that's great. Sometimes you don't have to see a physical change in somebody. Sometimes you can see it in their social status, in socializing. So, even in mental health, sometimes it can, create natural endorphins. It can, calm anxiety. It can help people just be much more calmer, biking in a park or something. So that's one thing. That's one case that I can say offhand.
Wow. Thank you for that. It's beautiful. You're also very, very big into your community. You're a community guy. How important would you say is a community in someone's healing process? Like, how do you bring that into your work, if you do at all? The community as a whole. Is that something that you feel is important for a person's healing process, or you did mention that in one of your answers that community sometimes need a little bit more of they feel like healing could be difficult by a person by oneself. So perhaps a community can come together and help in certain ways.
Well, eventually, a person who has, say, a physical disability or is learning a skill is going to have to kind of integrate it into their community for community use.
Right.
So I definitely feel that eventually that's where they're going to have to go. So whatever you do with them will have to lead into that. Sometimes a person doesn't want to know, or sometimes a person doesn't want other people to know their struggle, and may not want that success to be brought out in the open. Sometimes we have parents who call and say, "Hey, I have a kid, but I don't want to do lessons for bike riding in Brooklyn. I want to go out to Muncie or New Jersey. I don't want anyone to know my son is learning how to ride a bike." Eventually, when he learns, he can come back and use that skill there. Or sometimes you have a person who has a weakness in a certain muscle and it's affecting their walk, and a parent tells me, "Hey, my kid is walking funny in the community, and everyone's looking. Can you help my son get rid of that, limp?" And they come to therapy or have me come to their house because they don't want people to see. So I understand, there may be some stigma with therapy or learning a skill, especially in front of other people. But eventually, you're gonna have to take your skill and use it in the community. So I
Well,
think community is a big part.
absolutely, absolutely. As all therapists, how do you avoid burnout yourself as a clinician and a leader? What fuels you?
I'm gonna go back to what I said before, to a great line that I learned. I don't remember who it was. I can't attribute it to anybody. But if you love your job, you'll never work a day in your life. And if you can wake up in the morning and say, "Thank you, God, for waking me up today and having a need for me to go out and help people," then you have a mission to go and live and to help other people. God gave you a brain, He gave you skills. And if you can do that without even thinking about the money part, and do what you can do best and share it with the world, God will make you successful. And when God makes you successful, you're going to want to do more of it and spread more light. So burnout is for people who chase the money or who don't have a skill and who just go from job to job or wake up every day just to pass the time. I don't feel that I'm doing that. I feel like I wake up with a mission, with a calling, and I'm here to help people. Yes, sometimes it can feel like it's taking long, or sometimes you don't feel you see a difference from yesterday to today. But in reality, every day is different and it presents different challenges. And you can see success sometimes in one day, in a month, a year, but every day is something that can help someone. And if you can help someone that day, your mission was accomplished. So if you have that in mind, you're never going to have burnout. Physically, if you feel like you can't do it, take a day off, heal, go for a massage, spa, relax, walk on the beach, take care of yourself. But know that you have what you have because you are there to help other people. And it's not just for yourself.
Wow. Wow. Beautifully said. Burnout really happens when we lose connection with, with purpose with people. So I definitely think that taking some time off, when a person can't physically be there to continue working, to take care of their self, absolutely. Self-care is number one. What mistakes, or what one mistake that you see patients in the ODA or in the schools or facilities you work in, if you see any mistakes, perhaps that patients or even other clinicians make in the recovery process. Have you ever noticed anything that you find that can help, perhaps they can correct or do better?
Yeah, it could be with clinicians or patients themselves, unrealistic goals, experiencing too much pain, and pain is subjective, setting goals, understanding the process. The process itself builds a person. So going through the pain, going through the struggle, it builds a resilient struggle muscle and helps you become stronger. But if you're coming and trying to learn a skill or to, relieve yourself of a certain pain and you set unrealistic expectations, you're setting yourself up for failure. So my best advice is go into whatever you're doing, whether it be learning a skill, whether recovering from an injury, or a goal of becoming stronger, improving whatever it may be, your endurance or coordination or your balance, and go in there without a limit, and don't expect things from yourself that you may not achieve right away. If you have low risk tolerance and if you can't come into therapy and say, hey, whatever happens today, I'm fine with it, or I'm learning a skill, and if I don't get, all the skills in one day, I'm fine with it. So not having too much expectation of yourself will probably lead to a lot more success. And then pain. Sometimes pain, well, most of the time, pain is in your head. And the more you think about a certain pain, whether it be from a certain body part or something that's going on in your head, the more time and space you give it, the bigger it becomes, and it can take over, the recovery process or a skill that you have to learn. So try not to give the pain that you're going through, whether physical or mental, enough time to actually, grow. Try to suppress it as much as you can, and this way you can achieve your goal much quicker. But that's probably one of the biggest mistakes we see, is that we give too much space for pain and we have unrealistic expectations.
Wow. Wow. Okay, let's dive into gear. Let's talk gear for a second. What bike do you personally ride? Or what would you recommend for someone just starting out? But it could be somebody who never learned before, it could be a child, a bacher, or even somebody who post injury, they're just beginning to ride a bike, they're learning. Is there any gear you would recommend, any specific bike?
Yeah, let's start with a child. I would say if it's a typical child without any delays, and he feels like he can pedal very well with training wheels, then I would say the best bike company that I found the most success in is called the Guardian Bikes. And
Guardian.
Guardian Bikes, yes,
Mm.
and they come in all different sizes. They're much lighter. They have one handle bar brake, which stops both wheels. There's no coaster brake, so when you pedal backwards, you're not stopping. And it's much lighter, like I said, adjustable seat. It's thinner wheels. Um, The company itself is a great company. Uh, they let you return the bike within a year. If the child outgrows it, they'll give you a full refund, and you can put that money towards a bigger bike. All you got to do is just donate the bike that you have currently to say a nonprofit, and they'll give you a bigger bike, which is I think fascinating. So you never lose, never lose with the company itself. But the bike itself is built very well, lightweight, especially that's what kids need. Sometimes they're very thin and frail. They can't pick up anything heavy. Also, it has one handbrake for both wheels. So this way the child doesn't confuse pedaling backwards to stop the bike as opposed to pedaling forward to make the bike go. So it's two different pathways, hands to stop and feet to go. So I think it's one of the best companies that
Wow.
I've worked with.
And I'll put that in the show notes, the Guardian. Any specific gear for their head, a protective gear, perhaps a helmet that you recommend? Perhaps the company produces their own helmets?
I believe they do. I'm not quite sure, but any helmet would work, for kids. Just knowing that they have to be safe. Helmet, knee pads, elbow pads, wrist pads. If that's the type of child that you have, or the type of person you are, very safety based, and you have a lot of concerns and a lot of anxiety, then you can do that. As time goes on, you can start taking them off, but definitely keep your helmet on. 'Cause that's something you can't compromise. The other gear is not the most important, because it can hinder sometimes pedaling, and it can irritate your skin, your joints. But a helmet definitely you need to have, and anything works, whatever's comfortable for you.
Wow. Thank you for that. I could think of so many kids and Bacharim that can learn, that need to learn to ride a bike. Just, for coordination, for strength, for motion, for exercise. Um, you know, Going into advice, if you can give, or what advice would you give to a young therapist who wants to go beyond the traditional clinical model and find their edge like you did? If somebody's starting out, just graduated, became a physical therapist, perhaps just starting the program, is there any advice you would give them?
Yeah, so at this point, you've probably done your homework, and you know that you want to do this long term. Sometimes time is going to pass by really slowly, and I know that's what happened to me when I was in the program. But I know that I took it one day at a time, 1 month at a time, one semester at a time, and eventually you're going to finish. And once you finish, you'll get a job and you'll start working. But the process is what builds you. So if you have patience and know that it's building you, one day, 1 month, one semester at a time, you'll eventually get through it. And then while you're in school, I would say, use that time wisely to find what subcategory of therapy you want to do, whether it be working in a hospital, nursing home, outpatient, working with athletes, kids, depending on what you want to do. But that's the best time you have to kind of learn what you want to do in the future. Because as a student, you're more on the receiving end. You're not pressured to make money, pay bills, so you can learn better. Once you're out in the field and you're actually working, it's a lot harder because sometimes money blinds you, and you're gonna want to do things that make more money, but it may be a dead end job. There may be no growth. You may not find happiness in the job itself, even though you're getting paid a lot. So I would say while you're a student, think about what you want to do, and then once you get out there, then I would try out different areas to see what works best for you.
Wow, amazing. And to finish off with one last question, I'm going to actually put two questions in one. How do you see the future of physical therapy evolving, especially with the integration of, we said, artificial intelligence? It will never take away our profession, but it will. Do you find it's going to be enhancing it? Do you find our profession is going to evolve in different ways? Perhaps there's something you feel we should better prepare ourselves, you know, become more skill based, become take on more courses, become more niche based, maybe get a specialty. Because I find that a lot of times when you're working on a specific niche, there's more. I guess you want to say there's more success than versus you doing, you know. In my case, I've seen so many different things. I've taken so many different types of courses, and I found that uh, it just there's so many approaches. So maybe choosing a niche you would recommend, or perhaps something else.
Yeah, so using AI right off the bat, you can have a whole bunch of different researches at your fingertips. So if you want to know which thing to use, which remedy or which method to use to help, for this patient, so you have that right off the bat at your fingertips to use with AI. Like I said before, I don't think it's a threat as long as you can use it for your advantage. People always want to interact with human beings. So I don't think it's going to take anything away from us. But if that's the kind of person you are, you have a lot of anxiety and you feel like, there's someone that or something that may take over your job, then I would probably say figure out something that AI can't conquer or accomplish that you could, whether it be a niche, whether it be subspecialty, and find that. That's what you need to do, and research what AI can and cannot take over, because I don't think it can take over everything.
Wow, thank you so much. Thank you. It's fantastic.
Appreciate you having me on your podcast, and I hope I answered some questions for some people at least.
Yeah. Beautiful.
Bro.